I am a patient with ankylosing, and it's funny. I've heard some patients say, we're good at isolation because all of us have to be super careful when we're under treatment. But this goes beyond that, and I do feel like I learned from my treatment. I've been in remission for 6 years off treatment, so I'm pretty much back to a normal life, but I do have chronic kidney disease because it weakens my kidneys to a point that they're functional but not great. And so I do have to be careful. I'm also one of those older people, so I do have to be careful. And I do think I have learned to cope with things through having ankylosing and going through all of the isolation that I had when I was taking care of myself. But also, it's true, my martial arts background did help me a lot with, there's always something in front of you that's going to be difficult to overcome, and you just put one foot forward and move towards it. And if you spend all your time thinking about what could go wrong, as they say, it's never what you think could go wrong that will get you. It's all the other things. So I don't focus on those things. I focus on moving forward, and everything is a step, and every step gets me closer to my goal, whatever my goal is. In this case, my goal is to stay at home and stay healthy until they say, okay, everybody, you can go back to work and go out about your day. So I do think it helped me a bit, but I think everybody is drawing from some experience, and I still think we're all having a little bit of panic type stress that we've never experienced before, because nobody could have ever predicted that this would happen to us. And one of the hardest things for everyone, but especially patients with an autoimmune condition, is trying to deal with what's out of our control and what's within our control and the response to this kind of health crisis, And in these situations, the patient can feel totally helpless or, at the mercy of the virus. And in fact, we need to recognize what we have control over and the things that we can do to regain some sense of power. Do you think you could talk a little bit about that, why it's important to identify and understand the differences in how we respond, and, especially how to leverage and build on those things that we can control?